Welcome to this video on ergonomics-related occupational disease surveillance, focusing on workstation design and posture. Our focus will be on health surveillance program diseases linked to ergonomic factors, specifically workstation design and posture. Surveillance involves the ongoing, systematic collection, assessment, and interpretation of health and exposure data to monitor and describe circumstances related to ergonomic hazards. Let's explore the key aspects of workstation design. Office design requires analyzing the job for risk factors and using ergonomics for improvements. Key elements include adjustable chairs and work surfaces set at the correct height for support. Footrests should angle up to 15 degrees if chair and surface adjustments are insufficient. Armrests should be soft and padded to support forearms, reducing muscle strain and fatigue. For computer monitors, ensure the display is positioned to easily view characters without leaning. The center of the screen should be about chin height, 14 to 30 inches away. Place it away from light sources to avoid glare and eye strain. This illustration highlights common ergonomic errors, which can lead to discomfort and injury. This is the Office of Horrors. Here is a guide to correct sitting posture. Note the 20 inches work surface height and 26 inches monitor distance. Ensure your chair is adjustable in height and tilt, with your feet flat on the floor or a footrest. Maintaining correct posture means angles of the elbow, hip, and knee should be between 90 to 100 degrees. Shoulders should be relaxed and the back properly supported. To avoid eye strain, look away from the VDT, use a screen filter, and adjust brightness. You should also take breaks to stretch and walk around. To reduce the risk of injury, you can control several factors, including distance, lift heights, twisting, frequency, and forces. Control distance by keeping objects close, within 20 centimeters, and altering the workplace. Control lift heights by using tables and stands to keep objects off the floor, and providing handles on tops of objects. Control twisting by ensuring objects are in front of workers. Control frequency by using mechanical lifts instead of manual lifting. Control forces by reducing object size and weight. Now let's look at the importance of proper posture. A good posture, or neutral posture, places the least amount of stress on joints and muscles, allowing them to work efficiently. Examples include neutral standing and sitting postures. A neutral standing posture requires keeping all parts of the body aligned. This includes ears over shoulders, shoulders over hips, hips over knees, and knees over ankles. Remember to keep your wrists straight. Neutral sitting posture is similar, but requires supporting the low back with the backrest and placing feet flat on the floor or a footrest, with knees slightly lower than hips. Remember to move around often, as staying in any one position all day is not good for your body. Awkward postures, like working with hands or elbows above the shoulders for more than 2 hours a day, can cause strain and lead to musculoskeletal disorders in the shoulders or elbows. Bending the neck more than 30 degrees for over 2 hours a day also strains neck muscles. The head is heavy, and prolonged bending can lead to chronic muscle soreness in the neck and shoulders. This chart illustrates how the weight burden on the neck increases significantly as the neck bends further forward. Similarly, bending the back more than 30 degrees for over 2 hours a day puts immense strain on back muscles and increases pressure on spinal discs, especially since the upper body is more than half of the total body weight. Squatting is a better alternative to bending at the waist, but prolonged squatting more than 2 hours a day causes pressure behind the kneecap and can damage the knee. Kneeling for more than 2 hours a day also builds pressure behind the kneecap and can cause issues. Wrist bending, while less of a problem on its own, becomes a risk for injury when combined with high hand forces or repetitive motions. To reduce awkward postures, simple fixes include changing the height of workstations, tilting work, using platforms, keeping items within easy reach, and pausing for stretches. As a case study, a mechanic kneeling for long periods experienced knee aches and pain. The solution was using a low stool with casters, rotating among different postures, and using the available tool. The image shows the kneeling posture versus the use of a low stool, which significantly reduces the risk of injury. Consider other solutions to avoid back bending or squatting in your ergonomics-related occupational disease surveillance, focusing on diseases caused by ergonomic factors. We'll look at weight handling, which includes forceful and repetitive movements, weightlifting, and vibration, as well as the importance of exercise and rest. Let's begin with weight handling. This involves the force required to manipulate objects and how that impacts the body. Forceful movement is one aspect of weight handling that can contribute to occupational diseases. High hand force depends significantly on how an object is gripped. A power grip using the whole hand is 5 times stronger than a pinch grip with the fingertips. For instance, picking up 1 kilogram with a pinch grip is as strenuous as picking up 5 kilograms with a power grip. This visual demonstrates the difference. Gripping with the whole hand uses stronger forearm muscles. High hand force isn't typically a concern unless lifting an object heavier than 4.5 kilograms per hand or squeezing with more than 4.5 kilograms of force. An example of the latter is the force needed to open a battery clamp or using cutters. Pinching with the fingertips involves smaller hand muscles, making 0.9 kilograms of weight a high-force activity. It takes 1.8 kilograms of pinch force to hold a 0.9 kilograms object. Pinching occurs when using small tools or handling flat objects like X-ray cassettes. A solution to high hand force is to use tool balancers. In this case study, using a heavy impact wrench, weighing about 11.3 kilograms, requires more than 4.5 kilograms of force per hand. By attaching the tool to a portable balancer, the weight is neutralized, significantly reducing the required grip force. This visual illustrates the case study. The before scene shows the use of the heavy impact wrench without a balancer, and the after scene shows the same work being done with the tool connected to a portable balancer. Risk factors often combine to cause injury. For example, combining high hand force with a bent wrist reduces grip strength. When using a power tool with a bent wrist, more grip force is needed. Using a different tool or positioning the part differently can help keep the wrist straight, reducing injury risk. Next, let's explore repetitive movements, another ergonomic risk factor. Motions are highly repetitive when the same body part performs an identical motion repeatedly without pauses. This commonly affects the hand, wrist, arm, shoulder, neck, and back. Repetitive motion causes wear and tear, like the grasping and reaching motions when sorting apples, which can lead to injuries if joints don't rest and heal. To reduce repetitive movements, consider this case study. Before, using a ratchet wrench to loosen and tighten bolts involves repetitive hand twisting, awkward wrist posture, and required force. After, using a small power wrench eliminates repetitive motion and maintains a neutral wrist posture, saving time. Intensive typing, such as data entry for 4 or more hours daily, is a specific highly repetitive motion. It involves rapid finger movements while the rest of the body is often static. These repetitive movements pose a risk for hand or wrist injuries and can stress the whole body, especially in awkward postures. Repetitive impact can damage soft tissues, for example, using the palm as a hammer, like when putting on hubcaps. Similarly, repetitively using the knee as a hammer, such as a carpet layer using a knee kicker, can damage tissues just like kneeling does. Frequent repetitive impact can lead to injuries. To avoid repeated impact, use tools instead of hands or knees. Easy solutions exist, such as using rubber mallets instead of the palm. For carpet layers, power stretchers are available that eliminate the need for a knee kicker. Now, let's discuss weightlifting. This factor involves the physical effort required to lift, carry, or push heavy objects. Lifting heavy objects increases the risk of injury. The strain on the low back can damage spinal discs, and the shoulders and upper back muscles can also be strained. Pay attention to the maximum weight and frequency. For instance, a one-time daily lift of 35 kilograms or 25 kilograms lifted more than 10 times a day increases risk. To reduce heavy lifting, take smaller loads or use mechanical assistance like hand trucks, carts, hoists, or conveyors. You can also reduce the risk of injury by getting help from a coworker. Frequent lifting can be as hazardous as heavy lifting due to fatigue. If muscles tire, strain shifts to joints and spinal discs, increasing the risk of injury. A maximum weight of 4.5 kilograms, lifted more than twice per minute for over 2 hours a day, poses a high risk. Awkward raising postures, such as bending over or reaching up or out, increase the risk of injury to the back or shoulders, even with moderate loads. Bending below the knees strains the back and requires lifting the upper body's weight. Lifting 11.3 kilograms 25 times a day in an awkward posture, like lifting above the shoulders or below the knee, is a high-risk activity. To reduce awkward lifting, store items at an appropriate height to avoid bending or twisting. Use rolling ladders for high places. Avoid storing things on the floor or heavy items above your shoulders. Instead, place them between knee and waist level. Next, we'll examine the risk factor of vibration. Power tools transmit vibration to the hands and arms, potentially damaging blood vessels and nerves. Vibration causes muscles to tighten, and a tighter grip increases the risk of injury. High vibration tools can cause effects in as little as half an hour per day. Moderate vibration is safe for up to 2 hours daily. High vibration, only half an hour. The image on the left shows a moderate vibration tool, safe for up to 2 hours daily. The image on the right displays a high vibration tool, safe for up to half an hour per day. To reduce vibration, use low vibration tools and ensure tools are well maintained. You can also use tool wraps or anti-vibration gloves. Keeping your hands warm also helps reduce the impact of vibration. Proper lifting techniques are essential for preventing injuries. Follow the guidelines shown in the visual to maintain a safe working posture. The do's include reporting problems and seeking medical treatment early. Check your workstation for possible improvements, such as placing frequently used items closer to you. Work with management to modify your workspace, and remember to take rest breaks, even short ones, to aid recovery. Finally, let's discuss the importance of exercise and rest in preventing work-related musculoskeletal disorders. Static posture is a significant injury risk factor, especially in an office setting. Try to spend at least 5 minutes every hour away from the computer. Remember to stretch only to the point of mild tension and incorporate these active stretches into your daily routine. Simple hand exercises can help. Tightly clench your hands into a fist, then release and fan out your fingers. Repeat these hand exercises 3 times. This concludes the video on ergonomics and occupational disease surveillance. Let's review some back and shoulder exercises. Stand up straight. Place your right hand on your left shoulder and gently move your head back. Repeat the same movement for your right shoulder. For head and neck exercises, move your head sideways from left to right and back to left. Then, move your head backward and then forward. Sitting at a computer for long periods can cause neck and shoulder stiffness and sometimes lower back pain. Do these stretches every hour or so, or whenever you feel stiff. Also, make sure to get up and walk around the office when possible. The images here illustrate practical computer and desk stretches that you can incorporate into your workday. These additional visuals demonstrate more stretches that target areas commonly affected by prolonged computer use. Thank you for watching this video on ergonomics-related occupational disease surveillance.